Let's look at acute post-traumatic stress disorder. We'll start with a quiz. The nurse is caring for a client who is a survivor of a disaster event. The client begins to display behaviors not demonstrated before, which manifestations should indicate to the nurse that the client may be experiencing post-traumatic stress disorder, PTSD. Select all that apply. Okay, we'll now select all that apply questions are evaluation questions. So I'm going to evaluate my answer choices against my topic, irritability and sleep disorders. Okay, so this would be correct. Flashbacks or recollections of the desire, this would be also correct. Regression to an earlier developmental stage, no, this is wrong. A feeling of estrangement or detachment from others, this is correct. Consistent discussion and rationalizing as to why the disaster occurred, this is also wrong. Repression or inability to remember an important aspect associated with the disaster, this is correct. Well, I know that PTSD is characterized by a sustained maladaptive response to a traumatic event. So in this condition, the client experiences recurrent and intrusive recollections of the event, which we refer to as flashbacks. The client would also have recurrent dreams of the event, acts or feels as though the event were recurring, and they experience psychological distress when internal or external cues resemble the event. So the individual avoids stimuli associated with the trauma or that particular event. For example, thoughts, feelings, conversations about the event, and persons or places that evoke memories of the event. So these are all in line with PTSD. They can also be unable to remember important aspects of the event, which we refer to as repression. So they will repress these memories and experiences. They can also experience somatic symptoms such as irritability and sleep disorder. So these are all features of PTSD. So again, PTSD is a disorder characterized by failure to recover after experiencing or witnessing a terrifying event. The condition may last months or years with triggers that can bring back memories of the trauma accompanied by intense emotional and physical reactions. Some of the symptoms you might see would be the nightmares or the flashbacks, avoidance of situations that bring back the trauma, heightened reactivity to stimuli, anxiety, or depressed mood. So in terms of our diagnosis, we usually see these symptoms in clients with PTSD. You would see those intrusion symptoms. What are intrusion symptoms? Here you have the events repeatedly and uncontrollably invading their thoughts processes. So that's what we refer to as intrusion symptoms. There's also avoidance of anything that reminds them of the event. You also see symptoms such as negative effects on their thinking and also on their mood. And the duration is usually of at least 1 month. And the syndrome can emerge months to years after the traumatizing events. You could also see biological changes due to impact of the stressor and excessive arousal of the sympathetic nervous system. So part of our assessment, what are we going to see in this client? Disorder develops after a perceived traumatic event. It could be immediate, it could be delayed. You also want to assess the timing of exposure to that traumatic event. Maybe it was combat situation or rape or murder or fire or any other catastrophe. Again, you want to assess their response to trauma. Is it causing intense fear or horror? You also want to assess recurrent or distressing recollections of the events through images, thoughts, or feelings, distressing dreams or nightmares, acting or feeling like the trauma is recurring. Is it having those flashbacks? Usually you want to assess for hypervigilance and exaggerated startle response. They are easily startled. they are hypervigilant. You assess for irritability or outburst of anger, and also avoidance or numbing. So these are things you will look out for. You want to assess. As part of your plan, you want to help the client integrate the traumatic experience, encourage the client to talk about the painful stored memories. You can have the client recall images of traumatic events with as much detail as possible. This is what we call flooding. And this must be done by staff with a high level of expertise. You want to use empathic responses to the expressed distress. For example, you want to tell the client, that must have been hard for you. Okay, so you want to use empathic responses. Remain non-judgmental about the client's shameful experiences or horrific experiences. So you want to remain non-judgmental. Allow the client to grieve over their losses. You can assist the client to challenge existing ideas about the event and try to substitute more realistic thoughts and expectations. So you want to point out irrational thinking to the client. And also you want to help the client recognize the limits of his or her control over the stressful events. You also want to help the client with emotional regulation. Help him or her label his or her feelings and find ways to express them safely. Teach them stress management techniques. Involve the client in anger management programs. You want to recognize anger as a normal feeling and teach timeout or other ways of walking away from problematic situations involving anger. Teach non-intrusive communication technique. For example, you speak in the first person. Move away from objects of anger. We can even carry out cognitive restructuring using thoughts like, this person cannot make me lose control. So you want to carry out cognitive restructuring. You want to affirm a thought. So you can say, this person cannot make me lose control. I'm not going to lose control because of this person and all of that. So you want to develop a schedule of regular physical activity with the clients, like walking, running, weightlifting. And you also want to use empowering strategies, such as keeping a journal of disturbed thoughts and feelings in response to flashbacks, nightmares, or other problems. You also want to teach methods to reduce sleep disturbances, like regular bedtime. You want to advise them to use the bed for sleeping and lovemaking exclusively, not for reading books or for watching TV. So if they should not sleep in the bed sleepless for more than half an hour. If they can't fall asleep, they should get up, move around, and then come back to bed. You also want to enhance the client support system. Refer them to self-help group. Include family and friends in psycho-educational activities. You also want to explore opportunities for socialization for your clients. Also educate the client regarding the recovery process, assess for and treat substance abuse if there's any. And again, you want to administer antidepressants.